folks like myself who don't know much about EMDR, or even those who are seasoned in EMDR, how often do we think about the ways in which EMDR can be adapted to be culturally responsive? And what might that look like to be doing culturally responsive EMDR? Also, how might solidarity between communities of color shape our present understanding and enhance the relationships with people we are serving? Welcome to People of Color in Psychology, the show that explores mental health topics specific to culture, diversity, and communities of color. I am your host, Jack Sen. Today, I'm pleased to introduce our guest, Woshumi Sen, a licensed clinical social worker practicing in California and graduated from CSU East Bay with a Master's of Social Work in 2012. Woshumi is trained in EMDR and specializes in the treatment of PTSD, dual diagnosis, anxiety, depression, and relationship issues with partners and family. Additionally, working with healing trauma and life stressors for adult women of color has been her population of specialization. In fact, Woshumi is also an EMDR therapist, and her work has been adapted to serve both South Asians and other communities of color. Woshumi will be a guest speaker at her alma mater, CSU East Bay, to talk to graduate students about preparing for licensure and exploring EMDR trainings that focuses on culture as an integral component of that training. As a South Asian therapist, Woshumi will be discussing a couple of key points in our podcast. Number one, cultural responsive EMDR, and number two, the need for solidarity and support for Black communities as South Asians and AAPI allies. Woshumi, thank you so much for being on our podcast today.
Thank you for having me here. I appreciate this.
EMDR is a form of treatment that's oftentimes used in trauma care. And I haven't really heard much about the field in terms of cultural adaptations or cultural responsive EMDR. Tell me more about this work that you are doing.
Yes, so I came across EMDR actually quite a while back. I just started getting more serious about it in the last year of my life. And the training that I actually took was about beliefs focused and culturally responsive EMDR. So the thing that appealed to me about this training is that there is this cultural humility that takes place. I know you hear the word culturally competent, and there's a lot of struggle out there with that word because it means that you know everything. And that's not it. It's more just about like meeting competence so you can serve the communities you've been working with, especially ones who've been marginalized historically. So coming back to your question, culturally focused EMDR is about staying curious. Trauma-informed care, when I think about it, I think about when you're in the space and you're in the presence of someone and they've had, say, culturally based trauma and adversity, there's going to be a lot of triggers for them. First of all, you as a therapist are in a position of power. So it's a very intimate space. And if the therapist doesn't have that presence, it can trigger all sorts of things, and then the person wants to shut down. One of the wonderful things about the current society is that we have more therapists who are from different communities of color. And I think that's really important because representation does matter in that space because you have shared experiences. I mean, of course, you stay appropriate within the clinical conversation.
Mm-hmm.
And at the same time, some of those experiences make you more relatable as a human being. And the person starts to, break down the walls they're putting up already just coming to therapy.
Yeah, in some ways it's just faster because there is that relatability and
Exactly.
people have a shared background, they get it. And so now I'm curious about the examples of just when we think about standard EMDR, we're thinking about folks who are talking about, eye movement, finger tapping method. I like to know more about what element of cultural content or how is it How does it play out in therapy for our listeners who either are curious about EMDR or who are actively doing EMDR? How does that play out in a clinical setting?
Absolutely. So if you are talking about the bilateral stimulation, that's actually phase four, which is, there's like different types that you implement in phase four around the desensitization process. So prior to that is the important piece around the cultural history. And you have phases that you're doing the history taking, then you're identifying like the core beliefs. So there are multiple phases before you even get to the bilateral stimulation. That is like the part that probably takes the longest because you're trying to clarify what it is that this person is trying to identify within themselves. But sometimes that's can be like implicit memory, which, that's ego dystonic. So we don't even know sometimes what that is for a while. So
Hmm.
in EMDR, being culturally focused is like, what is your first memory of this? There's this part, they call it the touchstone. You can go all the way back there because sometimes we have these like memories that show up as themes in our life. So when you're dealing with core beliefs, you're looking at all these themes through the lifespan, but usually they start at the present, most recent event, then you go back a little bit more, and then you can go back to a really early response to that particular type of theme because it usually shows up.
And this is in which phase of EMDR for folks who are less familiar with the different phases? Because I think there is a misconception EMDR is only this exposure piece. And
Ah, yes,
yes, and so maybe a little bit about education on that piece.
absolutely. Well, phase one is like history taking. And that's when you're trying to understand their entire biopsychosocial history. And then phases two to three is when you're starting to develop those more nuanced pieces, trying to identify what is the theme that you're trying to get to the negative cognition and then finding the positive cognition. And the person gets to figure out, well, no, that doesn't really work for me. Because, say, somebody who's experienced something like racialized trauma, they're not going to have the same themes going on. You got to be creative sometimes with that to understand what it is that they have gone through. So I would
And
say phases two and three will identify that more so.
okay, and so for example, racial trauma might be a theme, but racial trauma is stated so broadly. And thinking
Yes.
about your work, do you have an example just how, like thematically, like specific examples of working with
Oh,
a South
yeah,
Asian client and using that
for
to,
sure.
yeah.
Absolutely. Like, I think one of the things that a lot of people who immigrate here, I myself included, one of the things that has come up is like a sense of belonging. It's like sometimes they're accurate, I don't belong here. And then there's inaccurate, also negative cognitions that come up. So then you find a positive cognition that aligns with someone's, they call it validity of cognition, which will come later. It's like, hey, this positive cognition, sometimes it's so far back in the early onset that you may not be able to get to that positive cognition yet. You can say, I can begin versus I can, because it's so deeply rooted in their journey here.
Hmm. Hmm.
So that's an example of where the core belief, you kind of peel back the layers and figure out what that core belief and how it relates to the person, because not all of them are going to be relatable. Because
Hmm.
there's a set of core beliefs that we utilize, and then sometimes it takes some creativity to really get to something that makes sense for someone. So they're looking at subjective units of disturbance. And when you're at a certain subjective unit of disturbance, we're trying to turn that down. Think of like a knob, you're turning down the volume on the negative cognition, and you're turning up the volume on the positive cognition. So that's where you get like the validity of cognition getting really strong. You believe in this very strongly. And that's like going further past phase 4 because you've done the desensitization and so on and so forth. So for someone who's gone through culturally based trauma, that finding out the statement that relates to them because of their personal experiences, and then you might go through a couple of rounds and say, nope, that doesn't work. And then you come back and try again. In my consultations, we've talked about things like this. So as I'm getting certification, that's something I work on with my consultant.
So once people have identified, say, in phase 2 and 3, the negative core belief and the positive core beliefs, or some of the earlier positive cognitions, I guess because I don't know much about EMDR, so I do apologize. Once you move to phase
Okay.
4, what do you do with that, say, statement or the core belief? How do you engage with it?
I can just walk you through it. So we'll just say quickly, phase 1 is like history taking, your treatment planning. Phase 2 is like your preparation, you're doing some of the resourcing and preparing for that. Phase 3 is you're identifying the target memory. Then phase 4, and you're going bilateral stimulation. So that can be the eye movement, that can be the tapping. There's different modifications taking place based on what the clinician notices when they're observing the person. And then phase 5, you're basically installing a positive belief and a coping mechanism to replace the negative ones. So this kind of goes to like where you're figuring out to phase 6. Did you notice anything residual remaining in your body? And then phase 7 is closing up on it. You're also going to tell them, hey, this is what you would need to notice. So the next time we meet, they usually indicate not to have more than 2 weeks until you meet again. Because if you do that, it's hard to remember all those details of like, hey, I noticed this change, this shift. Phase 8 is the reevaluation and noticing any changes.
Okay. So when you're installing these new cognitions in thinking about working with clients of color, particularly South Asians, can you share with us how you have incorporated the culture piece into some of these phases?
Oh, absolutely. When you're doing that installation, you're again looking at like how much they believe in that positive belief. So if it's like something like, I belong, I can begin to believe that I belong in this society or in a workplace or in the community. That's where you start clarifying how much they believe that. And there's a system we call the validity of cognition to see where they're at. The objective is to get to like 7. So when it gets to 7, that means you really believe in the new cognition, the more adaptive one.
That makes sense. That makes sense. Okay. Thanks for sharing some of the details of the different phases of EMDR treatment. And what I'll do is I'll provide some information on the show notes about EMDR treatment so myself and other listeners can read up on it. And the other message, I guess, in thinking about your work, can you share with us, how did it come to? I think you've spoken passionately about needing allyship or as AAPIs in South Asian community to support and be in community with Black communities. Tell me more about that idea.
Absolutely. Just growing up in the San Francisco Bay Area, I grew up with so many different people from different backgrounds. So I was exposed actually a great deal in my own neighborhood to a lot of Black children. And I play with them. I grew up with them. Some of them are doing amazing things out there. So, as far as feeling accepted in my own community, let's just say it was a little tough to belong. Speaking of belonging, right? That can be traumatic when you don't feel like you belong. So, in that regard, I found a lot of acceptance from the Black community. and not so much acceptance from my own. So that solidarity piece, I didn't realize actually goes back to a very historical timeline in the United States history, dating back to when in the 1880s, Bengalis were here in Harlem, all the way up to the 1960s, where there were people who took concepts from Gandhi around civil disobedience and applied that into all sorts of civil rights movements. So there's been a history over time where there's a solidarity. So not to say it doesn't exist, it's just like it would be wonderful for us to continue on that path because historically our timeline suggests that when we support the Black community, our civil rights, and when I say our, I'm talking about South Asians and every other community of color, our rights are also affected. So I stand in solidarity and ask specifically the South Asian community to do the same because we actually have a history of doing this and to continue on that path. During the time, I remember in my generation, there was a movie called Mississippi Masala. The film director is Mira Nair, and it was in the South. Denzel Washington was in there and Sarita Choudhury. And they basically were, talking about a relationship. And this was 1992. And all of the cultural context of that relationship and some of the things they had to go through also. That mixing of our cultures too has been historically a part of who we are. Both have gone through oppression and imperialism in different ways. And yet there is this commonality around the discrimination. And I think maybe some people have forgotten about all of those historical pieces. And so I'm inviting them to come back.
Yeah. We really need to be rooted in that history and experience. I was just going to say, it's a very powerful message that you're delivering. Most importantly, visibly express the solidarity, because I think that's why you're, stating this, because oftentimes there is this passive, uncertainty of, do I support Black communities? Do I not? You're saying, no, you need to visibly state that support.
So what I'm
Wow.
saying is not old news. It's
Wow.
actually just not spoken about for some reason. And I want to bring that back up because I'm talking to other social workers. This kind of drew me back into the NASW, where I'm working with Black social workers and saying, hey, I want to talk about what you're doing on a larger platform, like Dr. Jasmine Smith. She talks about domestic violence in the Black community, specifically women, and why people are not looking at the metrics. And Dr. Maria Wright, she's talking about just like building community. They're all on the board for the NASW in California.
Oh,
So
fantastic.
yeah,
Thanks
So
for sharing this. I'm learning so much in our conversation today, and I will definitely share. Our listeners, I suspect, will also learn more about this. Now, let's talk a little bit about how you got into this work. Can you share with us any memorable events or circumstances?
let's just say that I had my own history with complex trauma. And so that over time has shifted me toward social work. I found the code of ethics just like profound, and they've even, changed over time just to change. I think in 2021, they made some changes to fit the cultural guidelines that are needed to support marginalized communities. So that I think is really important that those kind of things are happening in my particular profession. But what brought me here is that I think advocating and fighting for the rights of others is to me very fulfilling as a human being on a spiritual level, that it it's empowering to know that you can also empower others. And it gave me the little girl inside, like a rope to pull her toward progress moving forward. So that's what brought me into this field. And I think EMDR is exceptional in that way because they are very much about bringing in the cultural piece that we very much need in this day and age, very
Mm,
much so,
mm.
where
Yeah,
we
thanks for.
cannot live in a colorblind society.
No, we can't. No, we can't. Sure. Now, in thinking about, being a person of color, what were some challenges that you faced and overcame that you would be willing to share?
Absolutely. I think where it was the most profound, I have like three incidents I can just pick through. One is just as a child at age 10, I remember I was pulled into an ESL classroom and I was like, huh, I wonder why I'm in here. I could speak better than most of my peers and write pretty well. And I kept on asking, why am I here? So I realized much later in life that I was being tracked because my name was different. And I was already in the school systems for at least a good 5 years. So I was remembering that experience that people had misconceptions about who
Wow.
I was.
I mean,
Yeah,
that's another
yeah,
form
very much.
of, yeah, that's another form of otherness and making you feel like you don't belong, and of course, making you question your abilities. My gosh.
For sure.
Yeah.
Yeah, like around competence, right?
Hmm.
So I remember also just being in a workplace setting. Speaking of workplace microaggressions, I had a colleague who would just repeatedly make inappropriate marks about my ethnicity. And I actually had to take some, let's just say, some actions, make some actionable steps at that time. And I let them know, hey, did you really just say that? That's not
Mm, mm,
appropriate. It's time to stop.
mm.
Let me let you know what you could be saying.
Oh, wow. Wow. Wow, that's a
Yeah.
lot of courage. Oh, wow.
Yeah.
And it says, it's courage. It's also at the same token, wish you didn't have to go through that, right? Wish you didn't
No.
have to even, uh, address it. Okay. So, in thinking about, I guess your career landscape, what does it mean for you to be a South Asian therapist?
Well, I think about mental health stigma and I think about what mental health means in my community. And let's just say there's a lot of myths to dispel about what mental health is in the first place, because I think it's a very antiquated space around the thinking patterns. We'll talk about Bedlam days if that's where the concepts are really rooted from. So, in that way, having conversations with people around taking care of your mental health, what does that even look like? Like to be an advocate for that, I think inspires others to say, hey, we should talk about it too. It means that I have a voice for the people who don't have a voice, plain and simple. Because
Hmm.
there are people who are not talking about certain issues, whether if it's domestic violence, whether if it's shame and guilt, and just all of those concepts that are coming up that have been in existence, but people just don't talk about it because you don't want to dishonor your family. You don't want to talk about, you've done something to shame them. So for me, it's like breaking the stigma of shame.
It's very interesting as you're talking about this because it goes beyond the individual level of talking about these issues. It's also by being a South Asian therapist, there is this professional platform to talk about these issues more globally, more collectively, that these are things that are affecting our community. And so it's also speaking up for those who may be fearful of bringing it up at an individual level. Because individually, if I talk about this, oh, they're going to relate it to my family, right? But if you speak
Yes.
about this professionally, globally, it's hard to figure out, oh, well, who's the individual person that's being identified per se. Yeah.
Yeah, it's so nuanced, isn't it?
Yeah.
When you think
Yeah.
about that.
Wow. Wow. So it's amazing that, there's this great care in thinking about the community and trying to address these issues. So how can we support you?
Well, I'm going to continue speaking about these things, especially the solidarity piece. I myself am doing a self-care walk in for social workers in my local area in Pinole, California. My colleague, the one who's at the university, Dr. Maya Wright, she and I are collaborating. Well, I'm a vendor there, let's just say. She's actually the mastermind behind it, just promoting solidarity. I don't know how to say it any different. It's just like collaborate with people locally and then make that bigger if you want, because you can. You just have to
Mm,
put yourself out there and say what is morally sound, just like my predecessors from back in time, where they were saying, hey, this is not a political issue, this is a moral issue, which I guess falls into politics because sometimes the personal is political.
hmm.
So there's that.
Yeah.
But we'll
So
just
really,
say on the moral level.
okay. So you're saying in many ways you're encouraging folks to build those connections at a community level and seeing how in many we're really interrelated. We are connected in some ways, that the work of folks here, say myself here in Austin, Texas, it's going to impact the therapists in community and say California, where you're at some point in time we may meet again.
Absolutely.
Yeah. And not just that, the conversations of mental health care, the conversations of community care, all this is going to be shared and discussed at some point in time.
Yeah, I think the acknowledgement piece is huge. When you acknowledge and then you share and spread the message, the collaboration can take place because people are agreeing on this being
Important.
an issue. Yeah,
Yeah.
it's an
Yeah.
important issue
Yeah.
because
Well,
when you combine forces, that's what happens.
yeah. Well, Shumi, thank you so much for being on our
Okay,
show today. And any final thoughts?
get out there, get out there and meet people. I know the pandemic stopped us from doing that. It's time again for us to connect with people and build those communities so you can grow a strong force of people who are culturally responsive and keep growing that force.
All right. Well, thank you so much for your time and your work and teaching us more about culturally responsive EMDR.
Thank you.
A huge thank you to our listeners. If you enjoyed this episode, please share and subscribe to People of Color in Psychology. You can also support us by registering for continuing education courses or making a one-time donation on the Multicultural Counseling Institute's website. Your feedback is important to us, so feel free to send an email, a message on LinkedIn, or leave a voice message on our website. Until next time, this is your host, Jack Sun.